Right, so I'm going to do a very quick run through on gynecomastia now, and this is another picturing medicine diagram, and of course it summarizes the different causes of gynecomastia for you in a visual format. So what is gynecomastia? Gynecomastia is the formation of breast tissue in men, or apparent breast tissue, and it can either relate to glandular tissue or fatty tissue. And there are sort of different peaks affecting different age groups. So you can see how there's a sort of a peak affecting newborn infants, and that's due to the hormonal changes that occur in relation to the mother. And then there's another sort of peak at around about the time of puberty, and then again at an older age there's another peak as well. So this diagram summarizes for you the different causes of gynecomastia, and when assessing these patients one needs to be mindful of these causes so that you can identify them, at least consider them, examine patients appropriately, and then go about offering reassurance if that's appropriate, or perhaps further tests as required. Now from the top down, let's do it that way. So the thyroid, if it's overactive, can actually relate to the formation of gynecomastia. Liver problems such as cirrhosis can, and so can certain tumours of the testicles as well. So it's important in these patients to examine the thyroid, the liver, and the testicles to check for any abnormalities there. Patients who are malnourished can develop gynecomastia. Just think about cancer, because of course men can develop cancer just like women can. Of course, cancer is much more common in elderly patients. So if you're dealing with an elderly man, think about cancer too. Then there are a whole variety of medications that can lead to gynecomastia, but the classic ones: marijuana, so do inquire about illicit drug use, sedatives, spironolactone, that diuretic, and digoxin. So I've done the digitalis foxglove there just to remind you of that as well. Finally, there are different tumours that can all lead to gynecomastia, and these are tumours that secrete steroids or human chorionic gonadotrophin, and it can be the pituitary, in the lung, in the liver, in the kidney or the adrenals, and in the testicles as well. So remove the labels and then look at that diagram and just picture it in your mind, and just remember the different age groups that are affected, the different potential causes. Don't forget cancer. Don't forget obvious drugs that could either be potentially omitted or at least offer an explanation for the gynecomastia. And then other tumours too. And just examine, as I said, the thyroid, the liver, and the testicles in these patients. This is another picture from Picturing Medicine. And you can go to the App Store where you'll be able to find the app there, and of course download it. It's Picturing MD, and the website is www.picturingmedicine.com.